This video will explain the information about deprescribing proton pump inhibitors, also called PPIs. So you're probably wondering, what is deprescribing? Deprescribing means lowering the dose or stopping a medication that may no longer be helping or may be causing harm. So why do we deprescribe in hemodialysis patients? Hemodialysis patients may take up to 12 medications each day. Also, since many medications are not studied in hemodialysis patients, the benefits and harms are unknown. Hemodialysis patients may also have a harder time getting rid of medications from the body, so patients may experience more side effects. What are proton pump inhibitors? Proton pump inhibitors are medications used to prevent and treat heartburn and stomach ulcers. Some common examples include omeprazole or Losec, pantoprazole, also called Tecta, and esomeprazole, also called Nexium.
You may ask, why should we reduce or stop the dose of your medication?
Usually, only short-term use is required. Taking these medications long-term in chronic kidney disease may cause decreased effectiveness of other medications such as calcium carbonate, also called Tums, infections such as pneumonia or stomach infections, bone fractures, or fatigue and heart problems. Patients who have certain conditions should remain on their proton pump inhibitor medication, such as patients with severe esophagus inflammation, Barrett's esophagus, ulcers from an unknown cause, uncontrolled heartburn, or long-term use of certain medications, for example ibuprofen, also called Advil, or naproxen. So we want to reduce or stop the dose of your proton pump inhibitor. How do we do this? Patients who have been taking a PPI for more than 8 weeks may be considered for the PPI deprescribing trial.
Your healthcare team will help decide the best way to reduce or stop your medication. This may include slowly reducing the dose you receive for a few weeks before stopping the medication altogether.
There are a few things your healthcare team will monitor for after reducing the dose or stopping your medication. These include looking for heartburn symptoms and antacid use, for example, the amount of Tums you use instead. You may be wondering, what can you do if your heartburn symptoms continue after adjusting your medication? Your healthcare team may recommend starting a different medication, for example ranitidine, or to return to your previous PPI dose. There are also other ways you can manage your heartburn symptoms. This includes avoiding smoking, limiting the amount of alcohol you consume, avoiding chocolate and spicy foods in your diet, elevating your head when sleeping, and having regular exercise leading to weight loss.
You can speak to your dietitian to learn which foods are right for you. Overall, the goal of deprescribing is to lead to better patient care. Please contact your healthcare team before stopping or changing any medications.